Good morning, everyone. In this session, we will be looking forward. How do we get there? Our first speaker is Shaheen Dewji. She is going to talk on critical issues in knowledge management and domestic radiation protection research capabilities. She is a radiological engineer for the Center for Radiation Protection Knowledge at Oak Ridge National Laboratory. She has a PhD in nuclear and radiological engineering from the Georgia Institute of Technology. She has done assessment of patient release criteria for iodine-131 patients for the Nuclear Regulatory Commission and has done an update to the U.S. Environmental Protection Agency's Federal Guidance Report 12 and 13. Ms. Dewji.
Good morning, everyone. If you didn't notice, I think I'm the only millennial in the program to speak. Thank you. Yeah. I'd first like to start by thanking the NCRP for inviting me. I guess when John Boyce had come down to Oak Ridge National Lab, we had such a haughty discourse. He thought I might have something to share with the WARP initiative. So despite being the only millennial, as far as I can tell in the program, I'm a bit of a fair weather millennial. I found my 6th gray hair this morning. So I'm a little distraught. And I'm a bit of an old soul, so I'm sort of at the cusp of the Gen X millennial generation. But what I would like to do is discuss a philosophy by which we can approach the human capital crisis as brought up by the WARP initiative. So instead of looking at it from a body count, replacing a body with a body, looking at it from a knowledge perspective. So what I will be discussing is a little bit about the Center for Radiation Protection Knowledge and who we are and what we do, and as well discussing nuclear knowledge management, what that is, what the methodologies are, and then looking forward, how we can apply that to the human capital crisis. So I'd like to start with a quote by the sage Albert Einstein: "Knowledge is experience, and everything else is information." So a little bit about the Center for Radiation Protection Knowledge. Nolan spoke on this yesterday during his presentation a little bit. But if you have a look, you'll see some familiar faces, including Keith Eckerman and Rich Leggett, who have been very involved with NCRP, followed by myself, Michael Bellamy, our newest addition, Mauritius Hiller and Derek Yokish, who's our joint faculty appointment, and then some affiliates that we have, Ken Vino, Pat Schofield, and Scott Swan. But if you have a look here, you can see that there is a little bit of a graying of what was the traditional dosimetry team. And you're left with some bright faces in the middle row that have some very big shoes to fill. So with regards to the Center for Radiation Protection Knowledge, what is the value to radiation protection stakeholders? Why are we important? Why are we as a generation, as a capability, important? Amongst many of the goals, we provide the infrastructure and resources and continue to provide those in radiation protection and dosimetry. We seek to collaborate and communicate across organizational boundaries and capture critical knowledge before it's lost from organizational memory, facilitate the decision-making process. As was indicated, we work a lot with our federal partners, our federal stakeholders, to meet the nation's radiation protection needs, and as well to create a sustainable nuclear knowledge management system in radiation protection. So I'm going to focus on this last bullet in the scope of this presentation. So as we know, and this is why we're here, because of statements and discoveries in 2002, the Health Physics Society identified that there was an atrophy of talent, and as a result, the WARP initiative was born. But in my opinion, I feel like WARP is addressing what is a front-end issue, education and training, a little bit of this idea of filling in the bodies. But they've done very little, I think, to address the back end for the outgoing subject matter experts and the knowledge that will be lost. So just because you bring a person in does not necessarily mean that that critical knowledge will be transferred to that incoming generation. So we need to preserve radiation protection knowledge that might be lost due to growing retirements, although if the hand count yesterday was any indication, I don't think anyone's going anywhere anytime soon. So, but we are on on borrowed time. And knowledge management and radiation protection is an extremely high priority, and it must be addressed before our expertise is irreparably lost. And if you were here last year, Keith Eckerman, who is still a part of our center as a retiree, if you recall, he had a bit of a medical incident last year. So if that wasn't the red light to indicate that we need to be putting focus on this, I don't know what is. So as tragic as it was also very timely. So what is nuclear knowledge management? So I'm throwing this idea of knowledge management around. What does this mean? What is this concept, right? So knowledge management, and especially for nuclear knowledge management, it's an integrated, systematic approach applied to all stages of the nuclear knowledge cycle. We have a nuclear fuel cycle, well, we also have a nuclear knowledge cycle, including the identification, sharing, protection, dissemination, and preservation and transfer of this knowledge. It relates to human resource management, naturally, IT, process management, document management, corporate and national strategies, our domestic mission and research, for example. And the objectives of knowledge management hit upon 5 key places. These include safety, the economy, security, innovation, and as well sustainability. So for safety, by retaining knowledge, we're able to ensure that safe operations are continued. Economic, you achieve economic gains in your operational performance. You don't have to reinvent the wheel. Security, achieve responsible use by properly identifying and protecting nuclear knowledge from improper use. So that could be either malicious use or for use that, if not used competently, could be damaging to the people we're trying to protect. Facilitate innovation, and this is huge, and I'm going to touch on this as well again at the end of my presentation, to achieve significant improvements in the safe, economical operation of all new nuclear projects, and as well sustainability. Sustainability is one of the key issues here, and probably one of the most important of the objectives, and that's to maximize the flow of nuclear knowledge from one generation to the next. So in developing a paradigm, what does a human capital development and knowledge management look like? Right now, I feel like WARP is really focusing on the first 2 of these bullets, the recruitment and the retention. And I feel like the knowledge management needs to have the arrow going the opposite way, from the retirement to the resources to the retention back to the recruitment. And if you think about recruitment and retention, if you pull out your smartphone and type in, how long should I did that yesterday, and the first thing that came up on Google was, how long should I stay in my job? And if you hit search on that, I think it was probably when I entered the workforce full-time, they said 5 years. Now they're saying as little as 18 months. And I'd recently read an article saying that if you stay in your job for more than 2 years, 50% of your worth is gone in the market. So that's, I mean, I'm not looking to leave my job after 2 years, and I think if 18 months is the minimally acceptable period that millennials are thinking that is acceptable for a job, then we have a very critical issue here that needs to go not only from the recruitment and retention, but really focusing on that retention all the way up through retirement, and the reverse way. And if we want to take this pipeline paradigm and put it towards some elements of knowledge management system, you take the recruitment that is to something that's processes, the retention and retirement that's talking about people, and the technology is speaking about resources. So this is in a framework of an IAEA document. IAEA, of course, has a lot of turnover in their staff. So they've actually have a very well-developed knowledge management system and a lot of really good literature for you to refer to if you're further interested. So what is nuclear knowledge management? So how does knowledge management in general differ from how it is in nuclear especially? So when we're speaking about nuclear knowledge management, radiation protection and health physics, and I'll use those terms somewhat interchangeably, they have to be the foundation in connecting all activities. Those can be related to occupational, medical, space, industry, security, and emergency response. We've seen many lists in the past day. And as well for all the stakeholders, that can be federal government, academia, national labs, as in my case, the domestic and international communities, as well as NGOs, professional societies. So they're all interwoven together to support all these stakeholder needs. So instead of doing this warm body or blanket approach, we've sort of been talking about how do we fill, a certain role. But each of these roles is a little bit more or a little bit less difficult to fill. So I've taken 3 examples here from types of personalities or skills, positions that you would need in radiation protection. On the very first level, you would have a radiation protection technician who, for example, would do contamination monitoring or systematic surveys. On the next level, a health physicist who does dosimeter processing, bioassay work, does dose and shielding calculations. And then at the very next level is an R&D scientist, like the gentleman I work with, Keith and Rich, who do this fundamental R&D that do models, dosimetry, they calculate dose and risk coefficients. They work with the ICRP and NCRP to develop standards. And they have a long history of contributing new ideas to science through peer-reviewed publications. So when you're looking at your human capital crisis, you need to look at, if you lost one of these personalities or one of these roles, how hard would it be to replace them? In some cases, it could be training. The work could be very systematic. You can teach them how to, I think in nuclear power plants, they have very well documented procedures for if they have, for example, your technicians, how to do some of the work. Whereas if, for example, Keith Eckerman took a tank last year, who's going to be replacing that knowledge? So looking at the different roles, they each have different levels of critical or irreplaceable knowledge that you need to address as part of your knowledge management program. So how do we do that? How do we tackle this? How do we take this philosophy of knowledge management and try to implement that into something tangible? The first thing you need to do within your organization is conduct a knowledge loss risk assessment. You need to identify the population of experts who possess that at-risk, unique, and critical knowledge that you just couldn't replace through education and training. And that is conducted via a knowledge loss risk assessment to prioritize the knowledge. So really picking out what knowledge you need to capture that is not otherwise already captured through your operations and training manuals. So, and this is called the critical knowledge. So it's established within the context of a specific position. It is very important to the success of your organization. It is unique. So although some knowledge might be critical towards operations, some of it may be identified as being unique. And the way that this is done is usually work with your HR managers to conduct the knowledge loss risk assessment, which is categorized by a position risk factor. So I'll show you how that works. We couldn't get away here without having at least one equation, right? So the knowledge loss risk assessment works by calculating a total risk factor. So your position risk factor is the position criticality in your organization, the difficulty or the effort required to replace the position. And you can assess that person on a scale of 1 to 5, 5 of course being most critical or most urgent. And then you look at the attrition risk factor, how long until they're going to retire. So, I mean, for most people in this room, I'd say it far exceeds 5. So if you put the product of these two together, it comes out on a scale of 25. So this is a method that I mentioned before, the IAEA has documented towards approaching knowledge management and identifying critical knowledge. So if you recall those 3 types of roles in radiation protection, the technician, the health physicist, and the scientist, when it goes to doing knowledge prioritization, I'd say for argument's sake, you can say the position risk factor is a factor of 1 to 2 for your technician. It may be a little more readily, easily to retrain up another person, so that could be considered a factor of 1 to 2. As you go up the scale to a health physicist, a position risk factor of 2 to 4, it becomes increasingly difficult to train up a person to do that role at that level. And then finally going up to like a scientist level, it would be very difficult to build someone up to fill that unique and critical knowledge that was identified. So you could say that in the case of a technician, and this is not always the case, of course, but for the purpose of this example, you could say the risk of loss to the organization could be minimal. And as we go across those roles, it comes into a point where innovation could be stifled and the mission could not be met, and your mission statement could be in jeopardy as you reach a level of losing someone with critical knowledge. And if you're just wondering how do we do this, the IAEA has identified a few tools. I've highlighted in red the ones I think are probably most feasible in most organizations in the United States. Looking at explicit knowledge, so knowledge we can capture, put in documentation systems, a little more easy to do with regards to training, all the way to the tacit knowledge, the stuff in the back of your head. And I mean, we go and knock on Keith's door, oh, why did you do this back in here? And he pulls a document off his shelf and says, oh yeah, here, there's a factor of 2. I mean, that would only come out of tacit knowledge. And the way that you're able to access that is through working directly with the person that holds the unique or critical knowledge. Mentoring or coaching as well plays a huge role. Storytelling to some extent. I would caution against leading with storytelling only. I would prefer the mentor coaching, working with, as well as interviews. But depending on the level of critical knowledge that you're trying to capture, you need to be very, very specific about how you operate with your interviews. And then the next step in the knowledge management methodology is to determine the approach to capture, maintain, and share this unique and critical knowledge. So you need to create a documented knowledge retention plan. So within the Center for Radiation Protection Knowledge, if you recall, the very last bullet is to develop a knowledge management initiative. And part of this is to outline how to capture both that explicit knowledge and that tacit knowledge from the outgoing subject matter experts. And ultimately, I'm hoping in my mind somewhere we can put this up somewhere electronically so that the broader community can benefit through some sort of portal or hub that is dynamic that we can contribute to and work from. And we see these sort of ideas with Wikipedia, et cetera. And I would like to highlight, I had mentioned previously the IAEA has a lot of documentation, but I've also been involved with the Next Generation Safeguards Initiative with the National Nuclear Security Administration. And they are making very concrete steps in their human capital development pipeline, in not only in the education and training, but they are also beginning to take a foray into this knowledge management, seeing what its role is and its importance is in sustaining a critical need. And the final item is to monitor and evaluate the knowledge management effort. How do we know that we're getting there? So looking at milestones, how do you know that your knowledge management effort is being successful? So from you conduct your knowledge loss risk assessment, and you find and identify what the critical knowledge is and who holds it. Metric of success is the percentage of map processes, and as well track the percentage of the completion of milestone tasks outlined in your knowledge retention plan. And then with respect to your organization, how is the knowledge management effort affecting your organization? So your human performance errors may be decreasing because your staff are learning through the transferred knowledge. There's less outsourcing, less need to rehire retirees. That's showing that your knowledge management effort is successful. You're meeting your business and your mission goals. And finally, at least in the case of science, can say that innovative R&D is being conducted, so proposals are being funded, work is being published. So this is the rough rubric for how we're proceeding for knowledge management at the Center for Radiation Protection Knowledge. So I'd mentioned this knowledge management strategic plan, and we talked through some of the tenets and the tools. But I think really a lot of what proceeding with knowledge management needs to be predicated, and I encourage NCRP to step up in this role to develop a strategic research plan in radiation protection. If you are going to go to OMB and say, you need to save a health physics program, they're going to say, why? I mean, I was part of the nuclear engineering student delegation for a couple of years trying to ensure that OMB, the Office of Management and Budget, would continue to fund nuclear engineering students because it was one of the very few means that had, I think it was a line item, to retain that funding. And they would of course push back. And they ultimately did end up continuing with the funding, of course, but they would push back and say, why? Why can't you go to NSF, for example? And I think to get the government on board with showing how critical this issue is, you have to show them this is a role, this is a research role that we need to fill. So we spoke yesterday, for example, about low dose, right? I mean, there's any number of challenge problems that we need to discuss. Start from that level. What are our knowledge needs as a nation? What is our research need as a nation? Come up with those. For example, Eurodose has a very excellent research strategic plan. Leading with something like that, we can say these are our needs in research. And then you lead with, these are the people that we need to fill these needs. And I mean, otherwise we'll have to outsource to the Europeans and they'll have to tell us how to do our regulation because we won't have the personnel here or the knowledge to do it. So I think having that research plan is really instrumental and goes in tandem with the knowledge management plan for ideas for solutions like the consortium we discussed yesterday to be successful. As well, operating with the Health Physics Society, American Nuclear Society, professional societies, integrating that network and working with experts that are part of that to come on board as part of this. And then I am going to put a pitch in here, looking at next generation challenges, always looking for those challenges, where we're going to need the knowledge, where the knowledge gap is, and to discuss it. So I'm going to put a pitch in here. So this year at the Health Physics Society meeting, Nolan Hertel, who's our center director, is going to be leading a session on next generation challenges. This was very successful last year. We had presentations from academia, federal government, laboratories, committees, the Center for Radiation Protection Knowledge, as well. John Boyce spoke last year from the NCRP, and we had Werner Room from Eurodose speak. So really talking about challenges, not only just as a nation, but as well as a radiation protection community globally. And if you were there, I think you remember Rich Bray's presentation. That was very memorable. He can tell you about that. And as well, I'm going to pitch this year in Vegas, American Nuclear Society, looking at a little more of a tangible aspect of knowledge management, software sustainability, and radiation protection, and radiation protection shielding and data codes. So although knowledge management might be a little philosophical in its concept, there's some very concrete steps that we can take as NCRP, the Center for Radiation Protection Knowledge, within our organizations and professional societies towards actuating this into a tangible solution. And I would like to finish off on a book by Tom Friedman and Michael Mandelbaum. I think it was written about maybe 5-6 years ago, called That Used to Be Us. And Tom Friedman, and I thought it was very timely because he's actually from Bethesda, leads with how it took more than 6 months for the Bethesda Metro escalator to be fixed. Whereas in the same duration period, I mean, you see this all over DC, there's always something being fixed. Whereas in the same time period, China was able to build a 2.5 million square foot convention center with many of their own escalators. And he says, are we being stifled in innovation? You know, did that used to be us? You know, why are we not innovating? Why are we not feeling the need to do what we used to do so well? So his solution was, we need to invest in education and training. We need to invest back in research and in innovation. We can all agree that these two items have really been stifled, especially budgetary constraints, et cetera. But I think if we do come together and identify what these needs are and work in a consortium, for example, we can really leverage these resources together and not become antiquated, as was initially conceived in the concept of this book. And to finish off, I don't think that we can afford to wait for some sort of emergency or event that forces us to test how good is our human capital. You know, if an event occurs, we don't want it to be too little too late. The ramifications of not having a concrete human capital pipeline could be very detrimental when they're called upon to do something. So with that, I guess we'll take questions at the end of the session. Thank you.